Well, greetings, amazing students, and welcome back to another week of lifespan development. For this week's lecture content, we are going to be focusing on a topic in particular that, again, can be one of those that's a sensitive topic because of our connection that we may have to the topic. This week, we'll be focusing on the topic of substance dependency and substance usage as it impacts individuals throughout the lifespan. And so one of the key characteristics we're going to do for today's lecture is to discuss usage rates, common substances that are used, in fact, abused here in the United States, and what can be the potential considerations and impacts for individuals who use these substances or have raised under the impression, like influenced by these substances, some of which have been in utero circumstances, right, during the development in the womb. So we're going to discuss substance dependency for class today. I want to put a caveat on this that since this is a delicate topic in the fact that some of us may have been touched personally by substance dependency that may exist in our own families, backgrounds, have influenced friends or family. Maybe some of you have lost someone to a substance dependency issue. Then what I want to do is let you know, feel free to reach out to me in particular, email me, give me a call. I'm happy to connect with you and serve as a resource for you, okay? Now, in the course of our lecture for today, we will discuss substance dependency, really starting in utero and moving through the lifespan, but we're also going to put a focus on three particular substances for today's lecture. We're going to discuss alcohol and alcohol usage. We're going to talk about the opioid crisis, and we're also going to discuss the legalization of cannabis. We're going to discuss those three substances in particular because they are the most commonly experienced or engaged with in terms of usage with healthcare professionals, future nurses, speech pathologists, and throughout my own career, I've really seen individuals impacted by these three substances in particular. So we're going to put an emphasis on those, if you will. So what I'm going to do is go ahead and share my slides, and we will get started for today. We're going to start with the topic of substance dependency and its impact on physiological development, okay? And so that's where we're going to start for today's lecture. Now, what I'm going to do is we're going to start with talking about substance use during pregnancy. Now, it's not uncommon that I've worked with young mothers who didn't know that they were mothers at the time and had been using substances during the very early stages of their first trimester because they were unaware that they were pregnant. And as a result of that, the fetus was exposed to substances in utero, meaning inside the uterus, right? Because the mother had consumed those substances. What I often saw was the most common substance that was used by women during those early stages of their pregnancy was related to alcohol. And it just so turns out that according to research related to substance dependency, the highest rates of alcohol and drug abuse are with women who are in their childbearing years. Women who are using substances, particularly alcohol, do so at higher rates during younger periods of their lifespan development, making them very vulnerable to the possibility of unintentionally exposing the fetus, right, to substances including alcohol. Approximately 6 million women are currently experiencing alcohol-associated problems and about 5 million related to illicit drugs. So we see here in the United States, we're no stranger to substance dependency. Alcohol, the opioid addiction, the legalization of cannabis. Now, even though alcohol and cannabis are now considered legal at the state level, right, in our country, it doesn't mean that there are no health implications related to it. We're going to talk about some of those implications that we need to be aware of, you need to be aware of, especially in the healthcare professions, when students, kiddos, right, young adults may come to you and say, I was using cannabis, it was legal, I didn't think anything wrong could happen, okay? Now, statistics also tell us that greater than 50% of women ages 18 to 35 years old are responding to a National Institute on Drug Abuse household survey reported that they used alcohol in the past month, and 5% reported illicit drug use in the same interval, with marijuana being the most frequently used substance. I'd like to point out here that this is why it's important for healthcare professionals to consider this in your screening. That 50% of women within the ages of 18 to 35 are saying that they are using both alcohol and cannabis. Why is that a problem? Well, we both know that we all know that alcohol and cannabis for recreational use are not legal until the age of 21. What we also know, and we'll talk a little bit about this later, is that substance dependency can impact the neurodevelopment of young adults, and it can have a lasting impact throughout their adulthood. We'll talk about brain development. How long into your young adult life does it take for your brain to fully develop? If you're using in these early years of adulthood here, this can potentially have a ramification for health of your clients, right? Cognitive health and well-being later on in life, in addition to women using during pregnancy. Okay. Now, let's talk about alcohol abuse during pregnancy in particular. Chronic alcohol use during pregnancy is defined as the ingestion of 2 or more drinks per day and is associated with increased rates of spontaneous abortion, higher rates of low birth weight within infants, placenta abruption, increased perinatal mortality, ammonites, and a threefold increase in preterm deliveries. Alcohol is known to be a substance that can impact a woman's pregnancy in a very negative way, especially when used during the early stages of pregnancy. The definition of 2 or more drinks, we're going to talk about that in subsequent slides here when we zero in a little bit more on alcohol use in particular. But we want to be careful about 2 or more drinks and what that actually means. A lot of people think, well, a drink will constitute 1 pour of, let's say, a liquor or a spirit, or 1 can or 1 container of beer or some sort of alcohol. But it's not actually measured in that way. And so an individual can say, well, I'm drinking 2 drinks per day, or maybe less than that. I'm below the level of risk, or lowering at least my level of risk for alcohol related problems or symptoms later. However, we may not actually know how much alcohol we're consuming when we factor in total volume of alcohol percentage present in that drink. So we'll talk about that later. Now, in addition to some of the consequences of utilizing alcohol during pregnancy, you may encounter this. I pray that you don't, but you may encounter this in your practice, is that some children could be born with fetal alcohol syndrome, otherwise recognized as FAS. Fetal alcohol syndrome in particular is the only cause of intellectual disabilities. What used to be referred to as retardation, we don't use that word anymore. We use intellectual disabilities or neurodivergent, diagnoses that in theory is entirely preventable, right? So without alcohol present, a child cannot develop fetal alcohol syndrome. So this is something that we know is entirely preventable. But FAS affects 1 to 3 of every 1,000 newborns. That's a relatively high rate, with another 3 to 5 per 1,000 exhibiting less severe fetal alcohol effects. The spectrum of effects of alcohol in utero exposed that lead to FAS can vary amongst clients and children that are born. 2 children can be born with FAS, but it doesn't necessarily mean the symptoms are going to look the same in each. But we do know that usage of alcohol during the early stages of pregnancy are not a good idea, especially because it can lead to the development of SAS. Research also found that 30 to 40% of the offspring of women who abuse alcohol exhibit FAS. So if you look at that, that's a very high number. 30 to 40% of women who are abusing alcohol during pregnancy, the child is showing signs of FAS, which was associated with both chronic and heavy and binge drinking. So some women may say, especially those that are struggling with sobriety, may say, I won't drink during the week early on in my pregnancy, but I may drink on the weekends. We want to move and educate our clients away from that, because what we're seeing, right, is that still has a negative impact on the fetus. Whether you're drinking during the week or and that's like small amounts continuously every single day, or you're drinking heavy amounts in the evening, that has a negative impact on the fetus, okay? Now, I want to share some of the symptoms that you may see with children who are born with fetal alcohol syndrome, or FAS. There are some physical features that may sometime appear. Now, again, I want to reiterate, FAS doesn't necessarily look the same in every single client, right? It can look different depending on the client, and not all clients exhibit the same symptoms. So for that reason, we want to just be aware of these symptoms, but we don't want to typecast, if you will, that every single child with FAS will have the same symptoms. But in terms of when they manifest, in terms of facial features, we do see some symptoms and commonalities. Here are some photos, right, related to FAS. If you notice, the head is a little bit smaller in its development. There's a low nasal bridge that's here. That piece is lower, see lower on the face here. You can see different folds in the eyes and how they're sort of rounded out. You can see that here. The shortened nose, right? The nose is a lot tighter. And if you notice the lip, you all have like a little sort of groove right above your lip right here. That thin upper lip is I'm sorry, the flat mid face right here is flat, and then the philtrum right here is almost smooth, right? There's no dent there. And then you may see this underdeveloped jaw, see present in the line. Again, symptoms of potentially looking for FAS present. But there are also other neurological symptoms as well as behavioral symptoms that we see can impact a child as they move throughout their lifespan from infant into adulthood related to FAS. There are other complications involved, and it's quite an extensive list. And I won't go through all of them, but I do want to highlight just a few of the potential symptoms that an individual with FAS may experience. Abnormal facial features, such as the smooth ridge, which we talked about, small head size, right? And then we talk about things like children being born with FAS that have a very low birth weight. That may require them to stay in the hospital in the neonatal intensive care unit for extended periods of time in order to monitor their health. Poor coordination is what we may see developing through the toddler years into early adolescence. Hyperactive behavior is something that surfaces in young children. Difficulty with attention and memory. You may see, for speech pathologists, speech and language delay. So you may see a child, and let's say it's kind of on the fence whether or not you see the physical symptoms and the facial makeup of FAS, but you're starting to see that some children are acquiring language at a faster rate other than with the child who may be suspected of having developed FAS. And so we may see delayed in speech and language acquisition in those younger years. Later on in life, we may see limited ability or intellectual disabilities or low IQs manifested, poor reasoning or judgment skills, right? Problems develop with the hearts, kidneys, or bones because of that low birth rate and other developmental issues and nervous system abnormalities. The greatest education that we can provide to young women in particular is that even though alcohol use is very common and maybe even according to societal messaging popular during that 18 to 35-year-old range, there can be consequences with that, right? If we're also talking about unsafe sexual practices or the potential to become pregnant, right? And so we want to be aware, your patients want to be aware of the risks involved with that. Let's dive into alcohol usage in particular. Like I said, we're going to discuss alcohol, opioids, and cannabis throughout this lecture. Let's start with the alcohol piece. It's interesting that we are in a time period where alcohol is marketed in a very different way than it has been over the past. It used to be that alcohol was marketed towards certain demographics, older demographics, and of course we still saw usage of younger adults who wanted to engage in those activities. But really what we've seen is a diversification, if you will, of the marketing around alcohol. You'll see on the ads, look at your social media, listen to TV or radio and watch TV, and you'll see that there are ads popping up around alcohol that's available, and it's available all times a year. Alcohol manufacturers, companies that produce those drinks, are advertising that there's always a particular beer or seltzer or liquor that will be best for Christmas or to celebrate Easter or to celebrate the summer, right? Or to have at a local party. And therefore, consumers of alcohol are being bombarded with large scale media advertising, which is saying, look, alcohol is always available, but not a lot of the consequences are discussed. It sort of blurs the line for consumers, where consumers may forget what are the recommended limits for moderate alcohol consumption, what constitutes binge drinking, and what constitutes heavy alcohol use. So clients may come to you in your nursing practice and you're asking some of those initial screening questions. Tell me about how long, you exercise. Do you exercise each week? How many drinks do you have per week? And the answer may be fairly innocent, right? Oh, maybe I drink, like 1 to 2 a week. Or maybe some people are saying, oh, maybe it's like 6 to 12. But they're not really clear on what the limit is for low risk drinking. Now, it's also important to note that within the healthcare industry, what the typical advice of healthcare providers is that any drinking involved is risky drinking, whether it's considered low or moderate, right? If you want to avoid alcohol related complications, avoid alcohol. However, there are guidelines from the National Institute of Alcohol Abuse and Alcoholism, which actually quantify what is considered each level of alcohol consumption at the moderate, binge, or high level of drinking. So I want to review those with you now. Now, according to these guidelines, right, moderate drinking is up to 1 drink per day for women and up to 2 drinks per day for men. There's a distinguishing factor between men and women due to common size of body size, the ability to metabolize alcohol, and the effects. And so you'll see distinguishing, different numbers distinguishing the difference between men and women. Now, binge drinking is a little bit different. And here in the United States, we actually see that most individuals partake in binge drinking where they actually don't drink very often during, let's say, the week, or they may go brief stretches of not consuming any alcohol. However, at the weekends or celebrations or parties and things like this, alcohol consumption is very high. So the definition of binge drinking is typically occurs after 4 drinks for women or 5 drinks for men in about 2 hours. So think about, right, a common party setting. Think about a barbecue or a celebration in which alcohol is present. For many individuals, they may be blowing off steam on the weekend. They may not have had any alcohol during the week. But if you're consuming drinks at this volume and at this rate, that would be considered binge drinking. Now, binge drinking also, like another substance abuse survey said that binge drinking was designed or defined as 5 or more alcohol drinks, or for males, or 4 or more, okay, drinks for females in the same occasion. So at the same time, with the same couple of hours with each other. What we also see, and we don't want to forget, is that social drinking may lead to binge drinking, right? And so they're saying not in every case does it, but individuals who get together, they have a party, and even though they don't see each other per this definition, at least one day in the past month, right? If you're getting together every weekend to do this, well, you're definitely in the binge drinking category. Why do we want to be aware of this? Is because your patients may not understand this criterion. They may think that their drinking is relatively low risk when actually it qualifies for binge drinking. And then if we were to examine the definitions of heavy alcohol use is binge drinking on 5 or more days in the past month. So if you spent every weekend and potentially also one day, just one day, right, during the week consuming at the binge drinking level, that is considered heavy alcohol use. A lot of individuals here in the United States are engaging in this level of usage without realizing its risks. And so it's going to be present in your practice, okay? Now, I also want to touch on a topic related to another form of impact of substance dependency, and this would be in the in utero stage of exposure to substances. There is a syndrome referred to as neonatal abstinence syndrome. Over the course of my career serving in social services, I have had the experience of working with infants who are withdrawing from substances that they experienced that they ingested in utero. And so the child is born literally withdrawing from substances, okay? Now, NAS, or neonatal abstinence syndrome, is a group of conditions caused when a baby withdraws from certain drugs he or she is exposed to in the womb before birth. Now, these are drugs that taken during pregnancy, drugs can pass through, we know this, to the placenta and cause serious problems for the baby. All of those challenges, symptoms, complications that I noted for FAS can apply here as well, but it's also a very, very difficult delivery for the baby. The baby is born withdrawing from these substances and they need to be rushed off for care in the NICU immediately. And the difficult part is sometimes the delivery team is not aware of that until right before the delivery, if they're doing a drug test or things like this. And so it's important to understand, right, the risk of in utero exposure. It's not just related to the woman, and it doesn't just happen to the child later in life. Children can be born withdrawing from substances in utero right at the moment of birth. Okay. Why do I mention all of this is because in addition to alcohol consumption, another area that you are bound to experience over the course of your career is related to opioid consumption as well. Here in the United States, as many of you know, as many of you, some may have been impacted personally, there's an ongoing opioid crisis within the United States. The United States is consuming, as a country, large numbers of opioids. Individuals are either overdosing or becoming addicted to opioids, and it's having a significant effect on the population, on men, on women, on the middle class, as well as the lower socioeconomic status of those that live below the poverty line. It's impacting quite a few people. Now, a lot of folks are aware of the current opioid epidemic as it exists, the crisis, but they may not be aware of some of its history. There's a lot of history related to it, but I want to highlight just a few things for you so you're aware of where did this opioid crisis emerge from in our country's history. Well, in the late 1990s, pharmaceutical companies had reassured the medical community that opioid pain relievers were not addictive. They said, hey, this is a drug that's um, highly effective, right? It eliminates pain. It allows people to move past difficult surgical procedures and other painful recoveries, but you don't have to worry, right? It's not addictive. Healthcare providers then went on to prescribe opioids at increased rates, right? Widespread diversion and misuse of these medications became more prominent. And in 2017, more than 47,000 Americans died. They passed away as a result of the opioid overdose. In the same year, in 2017, an estimated 1.7 million people in the US were suffering from substance abuse disorders related to prescription opioids. Listen to that, prescription opioids. So these are opioids, 1.7 million people who are battling now an opioid addiction that was prescribed to them legally. So this was really, you see a rapid progression, right, in the challenges related to opioid use from 1990 to 2017. About 652,000 people suffered from heroin use disorder, 38% that same year, okay? Now, the opioid addiction crisis are some pieces that we want to know that are sensitive to your healthcare, future healthcare field. Every day, more than 130 people in the US die overdosing on opioids. Current opioids associated with the crisis, if you notice, are all from the morphine family. It's morphine and morphine derivatives. That's what opioids are. So those drugs include drugs like morphine, and morphine derivatives, including Vicodin, Norco, codeine, oxycodone, Percocets, right? And heroin and fentanyl. Many of you are familiar with fentanyl. It's been hitting the news and the headlines very recently. You've heard of the counter drug to fentanyl, Narcan, which is now being used or carried for within medical profession response ambulances, as well as law enforcement officers, if they do encounter someone that is in the process of overdosing due to an opioid. These synthetic opioids, heroin, very strong, very concentrated, but fentanyl is actually even a stronger concentration of the opioid, with a 50 to 100 times more potent than morphine itself in its natural form. These drugs, highly addictive, also highly dangerous, right, when consumed because of their potency. Now, the CDC estimates that the financial burden in the US, what it costs us every year, this opioid crisis, is an estimated 78.5, listen to this, billion dollars with a B a year when you factor in healthcare, lost productivity, addiction treatment, and criminal justice involvement, right? All of the arrests, the detainment, all of these things. This opioid crisis causes the United States $78.5 billion a year. So, as a healthcare professional, definitely want to be in tune with this, because it's not if you experience clients who see you who are addicted to opioids, it's when, right? Now, addiction rates of opioids have been on a steady incline. In particular, 2017 was a very heavy year for opioid use. Opioid overdoses increased 30% from July 16 through September 2017 across 45 states. So what we're talking about is opioid usage just moving its way across the country at alarming rates. Now, the Midwest region in particular saw overdoses increase 70%, right, from July to September in a little over a year's time, right? very significant usage increases here. And opioid doses in large cities increased 54% in across 16 states. Can you imagine, right? So large cities, New York, Los Angeles, Chicago, right? All of these jumping up by over half, 50% use, right, in that time. This is why we want to be aware of that. So I'm going to stop here with the opioid crisis. What I'm going to share with you then is that as you move into your nursing career, you're going to receive further specialized training around the notion of how to treat opioid usage and addiction. But you will encounter it over the course of your career, which is why I wanted to highlight it here. As we move forward in our lesson, I want to have a discussion about cannabis usage. And there's a reason why I want to do that. Cannabis is otherwise, referred to as marijuana, is a drug that is been discussed for a long time, for decades in our country. A lot of legal changes and evolutions have occurred regarding cannabis legalization over the past few decades. You are now growing up in a world where cannabis is legal. It's been legalized in many states. Now, I want to point out there's something to distinguish: legalized in many states, but not at the federal level. That's going to create its own sort of considerations that we'll discuss today. But let's transition over into cannabis use. Now, I want to provide an overview of that for a second. 20 years ago, cannabis was illegal in all 50 states. And to date, 38 states have legalized cannabis in some form of its legislation. Now, cannabis is legal in California for medical usage. California was actually the first to legalize cannabis for medical use, and that was way back in 1996. And later in 2018, it was legalized for recreational use. Now, a lot of people forget, and especially because we see cannabis usage very high in the adolescent, middle school age into high school. It seems so common for this age group to use cannabis. But we want to remember that ages for use of medical cannabis is over the age of 18 to obtain a recommendation alone. And under the age of 18, a recommendation can be obtained, but with a legal guardian. Now, if you notice here, it doesn't say a prescription for cannabis, medical cannabis. That's because in the state of California, as well as in other states, a doctor doesn't write a prescription for cannabis because it's still illegal at the federal level, okay? So it's not recognized as a drug to treat illnesses by the federal government. So as a result, doctors can recommend cannabis medically, but they don't prescribe it. The age of use for recreational cannabis in California is 21 and over. Surprising, given the level of usage, right? I've worked with high schoolers over the course of my career with high rates of cannabis use and addiction forming at a very young age. Cannabis can be ingested via smoking, edibles, tinctures, and via concentrates such as keef and shatter. So what we're also experiencing, especially in the drug groups that I've run and worked with students, is that most typically now younger students are actually gravitating less and less towards the what we kind of considered to be the conventional method of ingesting cannabis, which was through smoking. I see less and less students actually smoking the plant, right? But what I actually see is more students ingesting through edibles, tinctures, which are like oils that you can drop like on your tongue and ingest that way, or concentrates, concentrated forms such as keef and shatter. And so it's a much more potent um, acquisition or ingestion of cannabis at much higher rates of THC. That is the psychoactive drug in cannabis that leads to the effects that people often use it for. So THC, and CBD are two popular cannabinoids. There's actually a number of cannabinoids that are present in the cannabis plant. These are the most popular here. THC gives you the psychoactive effect. CBD gives you other effects that some early research right now says may have medicinal benefits in terms of preventing or reducing seizures within clients that have epilepsy, reduce swelling, and increase appetite for cancer patients. But again, research is very early in the process, and I'll explain that why, at least here in the United States. But the amount can vary per product, okay? Now, I want to point out, I have been saying that cannabis is legal at the state level, but we also have to consider at the federal level what the feds say about legalization of cannabis. What the feds are currently saying is cannabis is scheduled as a Schedule 1 drug here in the United States, which means that the federal government has determined that cannabis is not an approved medication in the United States. As a result of that, this is why doctors don't prescribe cannabis, medical cannabis, they recommend it. In addition to that, if it is considered a drug with no medicinal purposes or no medicinal value, okay, then it also restricts research that can be done on that substance. So, as a result of that, at the federal level, cannabis is still illegal. So you're growing up in a time where you have the federal government saying the substance is illegal. You have the state saying the substance may be legal, depending on the state that you're in. It may be legal for recreation or for medicinal use. Okay. And the definition of a Schedule One drug per the federal government, right, is that Schedule One drugs, substances, or chemicals are defined as drugs with no currently accepted medical use and a high potential for abuse. And then they included some examples of Schedule One drugs are things like heroin, if you see LSD, here's your marijuana or cannabis, right? Ecstasy, you see all these methaqualone and peyote. So this is where we have to do a lot of education for our clients, similar to alcohol. A lot of individuals think, well, the substance is legalized at the very least at the state level. It's marketed to you, it's advertised. These dispensaries offer sales on certain days of the week and all of these other things, right? How bad can it be for me? But there's more considerations for us to consider. Just because we can do something doesn't mean that we should. And so let's step back and kind of look away, not only at just cannabis, but our substance uses as a whole as a country. Do we really want to introduce a new substance which we know when we know we're already a substance dependent society? Our rates in the United States of substance dependency are much higher than other countries around the world. Do we really need another substance at this point, right? It's just something to consider. Just because we can do it, does that mean that there's a need for it? We currently use medicine to treat illness and retreat from life, right? So, what makes us think cannabis will be any different? What we've seen amongst high usage opioid users is that part of the reason that they use is not only for the physical pain that they first were experiencing, but they became addicted to that substance and they realized it also helped them just retreat from life. It took away the worries or concerns or the anxiety, at least for the time that they were under the influence of that particular substance. What makes us think that cannabis will be any different, right? If we're already taking sort of as a default reaction substances and using them to self-medicate our own emotional sort of worries or concerns away, at least in the moment, right? What makes us think that this would be any different? We also have to consider that with the cannabis legalization, we're ingesting genetically altered substances that have been laced with pesticides and chemicals. We have to remember, oftentimes they're saying, look, this is cannabis that's grown in a farm, it's grown organically, our farmers tend to this product. We also have to remember cannabis is a multi-million dollar industry, right? States benefit off of the revenue and the taxes of selling cannabis. Farmers are selling their product, right, to consumers. And so you need those crops to do well, just like other plants and agricultural crops. And so if you need your plants to survive in order to make a profit, you can't afford for those crops of cannabis to be eaten by bugs or diseased or whatever the case is. So they're sprayed with pesticides the same as others, right, in some cases. We're about only 9 years into the research, and so we're really part of the biggest medical experiment here in history. In the United States, we don't have extensive research on cannabis, though there are some exceptions to that. There are institutions that are doing cannabis research, but comparative to where we are globally with research, we're at a very early stage of that. Now, some of you, as you know, you're still in this younger stage of your life. Your brain is still developing. So if younger individuals are consuming cannabis at a young age, you really aren't going to see the effects of that cannabis usage, at least long term, right into when you're getting into the stage of advanced levels of your career. So again, just because you can do something doesn't mean you should. I would ask you to consider, where do you prioritize your future, right? If you know you want a future that's successful in the healthcare industry, or you want to have a family one day, you want to be in a relationship with someone you love, do you want to go the route of potentially developing some sort of dependency, right? Or experiencing the effects of cannabis usage because of the intensity, right, of the strains that are coming out now? Finally, mental illness and substance dependency are the largest disease, make up the largest disease version. We've discussed this, right, in previous lectures in the U.S. We know cannabis is addictive for some people, which may compound their mental health symptoms. What I have seen in my career is individuals who are already battling their own mental health and well-being. Cannabis intensified those experiences, right? It intensified some of the feelings of anxiety, of depression, of suicidality. And so we really need to be careful when we introduce another substance into society. It doesn't always mean that it's right for every person. And so we have to think about that. Other things to consider, right, is that California law is subject to federal law enforcement. So in California, right, you may not be, if you were pulled over by a California law enforcement agency, having cannabis, as long as you're within the legal rights of that possession, may not be a problem for you legally. But if a federal law enforcement officer were to catch you with cannabis, it is a federal issue at that point. California labor laws are also left to the discretion of the employer. Again, just because you can doesn't mean you should. So if you decide, well, cannabis is legal in California, I think I'm going to go ahead and use it for recreational. Your job may actually see it different. Your job may actually still require that all employees test clean, right, for any substances, including cannabis. And so you run the potential of losing your job or your career, even though this substance was legalized in the notion of purchasing it. Also to consider that 4 out of 10 strains were lab tested in recent studies and failed to meet requirements for pesticides and chemical contamination. We make the mistake of thinking that when we're ingesting cannabis, we're only ingesting the plant, when in fact there are other chemicals present in our lives, right? Now, there's a couple of things we've learned from cannabis, and brain development, right? So, quick question for you. Do you know about how long, at what age, the brain is fully developed in our lifespan? So some of you sometimes say 20, 21, 22, 23. If you said 24, that's about the age in when our lifespan and our brain is fully developed. So substance abuse is known to delay, in some cases, stop of development entirely. What I've seen over the course of my career is that children who are in utero exposed to drugs um, in the uterus, right, in the placenta, right, battled brain development later on in life. In some cases, what I saw was even teenagers in which their brain was still developing, engaged in heavy use of highly concentrated strains of cannabis, and it did impact their neurodevelopment. It set them back cognitively from their peers. Cannabis has been the leading illicit drug prior to legalization in the US for about the past 45 years, right? So, this is why this topic is still worth discussing because we haven't found clarity, right? Legally, let's say even ethically or socially around this topic. Even though we're leaning towards a place now in the majority of legalization, it doesn't necessarily mean that there's without consequences. Several studies, including 2 large longitudinal studies, suggest that marijuana use can cause functional impairment in cognitive abilities, but that the degree or the duration of the impairment depends on the age in which the person began to use and how much or how long they were using. So, in a nutshell, what research in longitudinal studies is finding is that individuals that were using prior to their brain fully being developed did experience more setbacks cognitively than individuals who used after their brain had fully developed, right? So even when you begin your usage or engage in that, right, throughout the lifespan, if your client, when you're asking your client, when did you first start using cannabis? If they said, I started using cannabis back when I was 14, definitely want to consider what would be the cognitive effects for that individual. Whereas someone that's 35 came in and said, I just, decided to start using cannabis maybe a year ago, right? In their 20s, late 20s. Okay. As people age, they lose neurons in their hippocampus, which decreases their ability to learn new information. Chronic THC exposure may hasten age-related loss of the hippocampal neurons. So one of the things that we're starting to see from research is that THC exposure may speed up the process of losing those neurons. Right. So again, just because we can doesn't always necessarily mean we should. And that's the message that we want to be able to relay to your clients, right? That you're serving in the medical professions, right? I understand that you can. I understand that you have a legal right to go in and purchase a substance. Let's talk about what it means potentially, right, for you and your future. Okay. Finally, I want to leave us with a passage that I think speaks well to this lesson today, and then we'll close out with our centering verse. And this scripture, this parable comes to us from Luke chapter 17, verse 11 through 17. And I want to tie it into this broader discussion around substance use. It says in Luke that on the way to Jerusalem, Jesus was passing along between Samaria and Galilee. And as he entered a village, he was met by 10 lepers who stood at a distance and lifted up their voices, saying, Jesus, Master, have mercy on us. And when he saw them, he said to them, Go and show yourselves to the priests. And they went and they were cleansed. Then one of them, when he saw them, saw that he was healed. He turned back, praising God with a loud voice, and he fell on his knees at Jesus' feet, giving him thanks. Now, this man was a Samaritan, right, who did not interact well. The Hebrews and Samaritans did not get along. And Jesus answered him, Weren't there 10 of you that were cleansed? Where are the other 9? Was no one found to return and give praise to God except for this foreigner, this one that we know historically our cultures have had beef with one another? And he said to him, Rise and go your way. Your faith has made you whole. Your faith has made you whole. So listen, I think this story, when we dive into it a little more, has some serious implications, some thoughts, right, that we should have around substance dependency. I had stated earlier in this lecture that oftentimes individuals use substances to combat their own emotional feelings of unworthiness, their feelings of vulnerability. And individuals may use thinking that they're going to feel better. They're hoping it heals them in the moment. Jesus is saying, right, that medicine can heal you. Sure, right? Antibiotics can heal your infection. A surgery, right, with the right treatment after can heal the wound left behind from surgery. But it doesn't mean that if you're healed, that you're whole. In these cases, the lepers were healed physically, right? But it wasn't until one leper recognized his relationship with Christ, came down and proclaimed his love for Christ, thanked God, right, for this healing, that Christ said to him, Now you're not only healed, you're whole. You are whole in the largest sense of the word. You are now complete because you are living with Christ. To some of our clients, what we're also trying to message to them is that they're attempting to heal themselves of the pain they're feeling. But even if they heal themselves, it's temporary and it doesn't mean that they're whole. What brings them to a place of wholeness is a recognition of their dependence, not on a substance, but on Jesus Christ, right? And so I wanted to kind of compare that messaging with you, give you that to leave with, right? Some may be healed, not all will be made whole. All right. Now, for today's centering, we're going to draw in on a scripture from John chapter 14, verse 27 that says, Peace I leave with you, my peace I give you. Not as the world gives, do I give it to you. Do not let your hearts be troubled or afraid. Jesus is saying here, there's a peace that I give you that the world cannot give, that a pill cannot give, that a bottle cannot provide. There's a peace that I can provide you that goes deeper into healing your wounds, that is maybe trauma based or fear based. I can heal that for you. I can give you a peace that you have never experienced, but you need to lean into your relationship with me. Do you have the courage, right, to dive into a relationship with me so that your hearts will not be troubled? You will no longer live in fear, right? So I want us to kind of think about that in relation to our lesson today. So let's go ahead and put our hands and feet in a nice comfortable position. Let's go ahead and close our eyes and draw in to Christ's message. Take a deep breath and let out as you exhale all of those concerns, the worries, the overwhelm, the tension you are feeling. Lean into Christ because Christ is saying, Peace I leave with you. I'm going to give you peace. I'm going to give you peace that the world cannot give you. So don't worry and don't be afraid. Take one more deep breath and draw closer into this message from Christ saying, Don't be afraid. I'm going to bring you my peace, right? And let's stay with that for just a couple of seconds. Okay, let's go ahead and open up your eyes. Take a nice deep breath and come on back. Folks, I want to thank you so much for again engaging in a great discussion. You know how to reach me if you need anything. Don't be afraid to reach out. I'm a support to you. Thank you all so much. God bless. Have a good one.